High blood pressure affects nearly half of all American adults, and surprisingly, many people don't even know they have it. Joining us with more is Dr. Rodney Young from Texas Tech Physicians Family Medicine. Dr. Young, always good to have you in and talking. You say that only 1 in 4 people who have had high blood pressure have it under control.
Yeah, actually, the numbers have been better at certain points in time, but as time goes on and science evolves, we figure out that really we need to change the target a little bit. So as we sit now, only about 1 in 4 people meet the current criteria for having it adequately controlled, and close to 40% of people that have it are totally unaware. They don't even know.
They don't even know. What are some of the signs to look for? I mean, again, they're going through life. They have no idea they're even dealing with it. What are some things that we would point to of going up? You might have an issue.
Well, one of the signs is having enough birthdays. So blood vessels wear out like everything does in life. So people go through their life and they go, I don't have high blood pressure. I never have high blood pressure. But I hate to break it to you, but now you do. And we're checking it. So that's part of the reasons, getting regular checkups, getting regular screens. Because, you know, we call high blood pressure the silent killer. That's because most of the time you don't get symptoms. People sometimes do, but that's not the norm.
In terms of the new data, what does that mean for families and here in our community?
It just means we need to be more vigilant about it. You know, this is an area where there's a lot of folks out there eating a lot of meat in our area and doing a lot of things. Blood pressure goes up. So high blood pressure is very common, and we need to be getting checked regularly or taking advantage of the opportunities to check it at the store or that sort of thing.
But what about blood monitors? Can we blood pressure monitors, can we buy them over the counter?
Yeah, absolutely. You don't need a prescription to get a blood pressure monitor. Now, I should say they're not all created equal. So you can get blood pressure monitors pretty inexpensively. You don't have to spend a ton to get a good blood pressure monitor. Typically, the more money you spend, the more bells and whistles come with it, but that doesn't necessarily make it a more accurate monitor.
So do your research before you buy, and then once you have it, any recommendations for people testing their blood pressure at home?
Yeah, the technique matters a lot. So when you're going to check your blood pressure, first off, make sure you have a cuff that fits properly. The automated cuffs that do it without you needing to use a stethoscope are more accurate. Typically the ones that fit on the upper arm are better, so make sure the cuff fits properly. It's on your upper arm. Make sure you're prepared when you're going to check your blood pressure. You shouldn't do it if you've had caffeine or nicotine or have exercised. Recently, all those things raise it. You want to be seated, ideally in a chair that supports your back with your legs uncrossed, feet sitting flat on the floor, arms supported, about equal with your heart, and then wait. You need to wait a good 5 minutes or so once you're in position to do that.
As we wrap up, what if we get a high reading? What should we do at that point?
Well, don't freak out initially. You probably ought to just chill for a few minutes and repeat the reading again. But if you get readings that are persistently high, you want to follow up on that.
Just chill. You heard it from Dr. Young. We appreciate it so much, Dr. Young. Thank you for being in here. And again, it happens to the best of us. It's out there. We still have a lot more Studio 4 on the way. Don't go anywhere.